I'm Aileen O'Brien. I'm a reader in psychiatry at St George's, University of London, and I'm going to talk to you today about mood disorders. What I'm going to cover today is an overview of the two main mood disorders, depressive disorder and bipolar disorder. And for each of these, I'm going to go through how we classify them, how we diagnose them, so the clinical features, the epidemiology, brief etiology, an overview of treatment and of outcome. First of all, I'm going to talk to you about depression. Depression is something that everyone at some point in their life feels low mood. What's difficult and sometimes a challenge clinically is deciding when the normal ups and downs of people's mood is more than that and is actually a depressive disorder. One of the most important things is that the low mood should be persistent and pervasive, so it should be there every day and for at least 2 weeks. Shouldn't be due to a primary medical cause, which I'll talk about later, or due to substance use, which again I'll cover later. This one's tricky, largely uninfluenced by external events. External events can precipitate a depressive episode, but the reason this is here on the slide is that most people, for example, would suggest that if you just lost someone very close to you, it would be normal to feel low in mood for at least 2 weeks. And it can be difficult sometimes to tease out when a low mood is a completely normal human reaction to something and when it is the start of a depressive disorder. And I'll go into that in a bit more detail later. If individual has experienced hypomanic or manic episodes, so episodes of high mood, then the depressive episode is in the context of a bipolar or manic depressive illness, and I'll talk about that as well. So there are 3 core symptoms as part of a depressive disorder: low mood, anhedonia, which means you don't enjoy the things that you would normally gain pleasure from, and anergia, lack of energy. You can also describe clusters of symptoms, biological symptoms, cognitive symptoms. I'll talk about both of those in detail. Rarely psychotic symptoms. Psychotic symptoms occur when the person, usually this is more common in people with depression in older life, experience delusions or hallucinations. So start believing things simplistically that aren't true, experience the seeing things or hearing things that aren't there, for example. And these would normally be mood congruent in depression, which essentially means that they will be unpleasant, negative in content.